Thank you very much. Good afternoon. It's a pleasure for me and for you and Africa to be part of this great initiative with relevant organizations and also great people, great visionaries like Carlos. So I'm going to share in this short time the Urban Inclusion Marker, which is an initiative that originated from a program which had the objective to address integration of people in a situation of mobility in cities of Latin America. This program is implemented actually, because it's not finalized yet, in 10 cities, and we were looking at how to measure the access to rights, services, opportunities, and infrastructure of people, not only refugees and migrants, but also from the host community, to try to understand what are the differentials, how we should address barriers, or how to facilitate this access. And I think the first speaker mentioned about the issue that it's a matter of equity, no? Also, when we talk about proximity, it's a matter of equity. And that's why we started looking at the notion of the right to the city. For those that don't know, we can summarize the right to the city, introduced by the new urban agenda in 2016, as per these three pillars. No? So one, the fair distribution of resources that we should have in a city shouldn't be any difference from the experience that we have of a city if we live in a particular neighborhood, or if we are living in a centrality of the city where standards and services are of a different level. Then the second pillar, ensure that all this, as I said, is equitable, distributed not only spatially but also for society groups. So there shouldn't be any difference in accessing this right if you are a person on mobility, on human mobility, or if you are a woman, a child, and so on. And then we should also ensure that there is inclusive governance, so that whatever we achieve continue to be a construction where everybody can participate and all the perspectives are taken into consideration. And of course, we took into consideration the growing interest and relevance of the concept of proximity. And the first exercise that we did, we created a composite index. We have so many composite indexes. We created a new one. So, and we said, okay, we need a photograph. No? So we selected 32 indicators, the most representative, along the 5 dimensions that you see there. No? That we consider that they cover all the social, economic, and environmental aspects that we should take into consideration. And we selected indicators that could cover the spatial aspect of it, so the proximity, I don't know, if we are looking at health, proximity to health facilities, etc. And also the socioeconomic dimension measured at the household level. And we came up with this index with the possibility to generate maps that, as you can see in this one, this is a city in Colombia, the city of Cucuta. These maps highlight the parts in dark, which are the areas of the city where there is there is less access, or the potential. They have less potential to have this access to the right to the city. No? So they have some weaknesses in one of those areas. No? Maybe affordable, adequate and affordable houses, housing services, and so on. And we realized that often, and even this index was highlighting that often, if you look at the entire city as an average, you can have a good the picture that you have could be a picture that gives you, doesn't give you a dramatic situation, because we saw that the average for this index in all the 10 cities that we measured was sufficient. But this was the result of having some centralities that were scoring very high and others that were scoring very, very low. So this was the first exercise that we did, and we, as I said, we looked at the different population sections, and we could already generate recommendations at the spatial level, focusing on some sectors. No? And as you can see here, there are the 5 dimensions with the sub-dimensions, and we ensure that they cover all the SDGs, and in each of these dimensions you can see that there is the possibility to see the fundamental rights that are covered, and by extent we can measure if we consider those indicators. Then we created immediately after a digital tool with the 4 layers. The first, to see how these resources of the city are distributed in the municipal territory. Then how the population diversity is performing in the city. Maybe there are some policies of the city that are encouraging some concentrations that we may be wanting, but also that are a side effect of our policies. The inclusive governance we saw for all these cities. We could isolate all the indicators related to how inclusive it is the governance of the city, and then the layer of connectivity to ensure that whenever there's no physical proximity, there is a good connectivity that can bridge this gap. And to conclude, we designed a toolkit in order to be able to go deeper into these sub-dimensions and look at the specific indicators. As you can understand, we can go up to an infinite level of a number of indicators, and what we did, we structured them in three areas. So one at the quantity level, so to try to understand, for instance, it's enough the infrastructure on health that I have in my city, it's enough the public space that I have, where is distributed, where there is a need to complement. Then the level of access, so as I said, proximity and the spatial access, and also possible barriers that could come when we look at the legal frameworks. So it's not only having a school next to my place, but to ensure that the policies that are in place allow my kid to go to school even if I'm a migrant or even if I am a low-income person, and so on. And the aspect of quality and standards. So it's not the same thing having an hospital or a good hospital or an hospital that is complying with the highest standards, or a public space. Not all the public space, pocket square or a very well equipped park are different. So looking at all and for all these areas, we had the possibility to look at specific indicators, go deeper into this research, and consider on this side the perception, so including also indicators of perception, and focalize on specific population groups. So this was done for several cities, and you can find the information in the website ciudadesincluyentes.org.